Hello, and welcome to the Functional Nurse Academy podcast. This is your host, Melissa Schreibfetter, owner and founder of the Functional Nurse Academy. Welcome, everyone. I hope you guys are all having a wonderful day. I have another really great show for you guys today that I thought would be like a really inspiring story. So I have my friend here with me, Anna Aycock, who has she is a certified nutrition coach. She is a certified light energy coach. She has her own business, and she has this deeply personal connection to holistic wellness. And she struggled for years and years with chronic fatigue and joint and muscle pain, fibromyalgia, all kinds of mystery illnesses. And she was able to find healing and restoration through natural approaches. And then this transformation she experienced then sparked a passion to learn anything and everything about holistic and natural living. So she is now dedicating her life to sharing these resources with others, empowering her clients and community with the tools that brought her back to health. And yeah, I am so inspired about your journey, Anna. Welcome, and thank you for coming back on the show.
Thanks. I'm so glad to get to do this again. I really enjoyed the last conversation we had.
Yes, yes. So
Right.
for our listeners, Anna, so we live in the same area, and I love holistic health, guys. I love functional medicine, but I really only feel comfortable recommending a handful of people because as I have said before, I don't feel like everyone is practicing with integrity, but Anna is one of those people that is practicing with integrity, and she puts Jesus first, and we've become friends. And I have my um toddler and Anna's granddaughter, who's also a toddler. We go out and do play dates together. And I was thinking, I was like, wow, Anna looks like really good for her age. And with all of this stuff that she went through when she was so sick in her 30s, here she is as like a grandma. I know people don't like that term anymore, but here she is as a grandmother running her own business and taking care and keeping up with grandbabies. And I was thinking, I was like, this would be so inspiring to just chat about, what happened with your health, how you got well. And then I also want to talk a little bit more about what you're doing in your business because you have all of these amazing tools to help people. So, can you start out by, telling our listeners about, what happened to you in your health when you got sick?
Sure. Yeah. So it was in my 30s when I became aware that I was sick. I mean, I look back now and what I know, I think I probably had some lifelong issues. But in my 30s, things really started shutting down. And I was going to the walk-in clinic every month with a new infection. It was strep throat, it was sinus infection, infection, double pneumonia. It just kept on going. And every time I would go in, they would put me on another round of antibiotics. And it just seemed to be chasing things around. And then, finally they said, well, you've got some things that are kind of pointing to autoimmune, so we're going to send you to a rheumatologist. And I had one visit with him, and it took 2 months to get in with him. And in the time I got to him, I found holistic resources. So that by the time I got to him, I had this list of all these nutrients that I was doing, and was already turning things around. And so he said, well, I'm not going to put any formal diagnosis on your record because you're already kind of making changes. And I don't think that you're going to want to do what I want to do anyway. He said, I would put you on antidepressants, muscle relaxant, and sleep aid. And he said, that's what my patients do. And you are entitled to come here. Your blood work shows that you are entitled to be a patient. But if you don't want to come back, you don't have to. So I took that as okay, I won't. So that was the last time I really was in the medical realm, and I kind of catapulted out of that into people working more with herbs and nutrients and paying attention to toxic load in the body as a underlying source of inflammation and working on ways to clear that. Um, and I ended up going to a few different practitioners and I learned more from each one. And then I felt led about 15 years ago. I was an artist at the time doing faux painting and interior design and thought that was my career path. But I was getting allergic to my work. I was allergic to paint. I couldn't handle the chemicals in the furniture store or the fabric store. So my career was kind of caving in on me because physically I couldn't do it. And I just kind of started to feel led and inspired to pursue, helping others in the same way that I had been helped. And it's almost like you become an evangelist. Like once your life has been changed, you just want to share it with others, and it's just a passion. So I felt led, but I was still very reserved about it, cautious about it, because at the time we had 3 kids in college, and I was like, I just don't think that I can afford to pay for me to do all that. So one of the leading functional medicine practitioners who does training, and he kind of did an extra special gift for me. So I'm not going to give his name out because he might not enjoy me telling what he did for me. So he basically offered for me to go through his courses, and in order to get them paid for, I had to sit in on all of the courses and document on a spreadsheet everything that was said at every moment of the session, so that I was sort of creating a directory. And as a result, I learned even more than the regular coursework, because I had to do that. So that was kind of how I kind of got started with getting some of the credentials. But over the years, I started out thinking I was going to have my practice be exactly like the person who helped me. But it's really interesting how God just shapes what things look like. And it looks very different from what I originally had a vision of what it was going to be like. My path has definitely gone into more and more about how vibrations impact the cells and the body. Um, I do a lot with sound, with light, and I've studied in depth about, how does red light impact us different than blue light or green light or um, infrared light, and understanding the different components of how the light impacts the body and what it does on a cellular level from the mitochondria. And the mitochondria, of course, is our energy, our power cells. So most of us that have chronic issues, it's kind of like the engines are just going really slow and everything. The wheels are just turning very slowly. And when they're turning really slowly, we end up with a buildup of debris that then creates inflammation. So there's lots of ways that we can address that. And one of the ways is to give more energy to the cells to kind of crank up the motor. And then the body can then clear things. Our pipes are more open. We can absorb the nutrients better and we can release them better. So, studying about sound and light and homeopathy, all these things, flowers, all these things are interrelated. And when you really look at it in depth, there is a musical note that correlates with a color, that correlates with an organ system, that correlates with a tooth. It's like we're all interconnected. And so understanding that level is just so powerful.
God is so good, and the more that I learn about this, my mind is just blown. And I've been so interested in frequency therapy and light therapy, and then also being a follower of Jesus. And I know we've talked about this before about, just being mindful of like, of certain like new age infiltration that may not be Christian, but when, because I know that we've had conversations before, and I just did a show on this, gosh, like maybe 2 weeks ago, about where I interviewed an ex psychic, and she talked about Reiki and she talked about tarot. And there's a lot of practitioners that are saying, like, oh, I do, light energy, but then they may be doing things like, here are my light energy cards, which are basically tarot cards. But then
Right.
I think with what you do, you are technically a certified light energy coach. Can you tell us the difference between the two? Because I think so many Christians get kind of, it can be a little confusing for us because we're like, okay, like what type of light energy are we able to do?
So, my certification as a light energy coach is through the Board of Alternative Natural Health Sciences. And I studied with Solus University to learn about um, really learning more about what do the vibrations do with, like I said, with different colors, with with homeopathics, and one thing that's really fascinating, and this is something that I'm also have studied and continue to study and follow Vita Institute. It's a sonic alignment, and it's Gregory Hyde and Elena. Let me get her name. Just
Is that the tuning fork?
yeah. Well, so that's one of the two.
Okay,
So there's a couple
so
courses.
interesting.
So Gregory Hyde and Elena Marani. So what they have inspired in me to focus on, which is just brilliant, is how the shape of things is sort of has a vibration that matches the the body system. And the most basic illustration of that is the kidney bean. Kidney beans look like the kidneys. And kidneys, there are nutrients in the kidneys that actually help support the functioning of, kidney beans that help support the function of the kidneys.
So, it really is like and I talked to my 8-year-old about this, and it is so interesting to me the complexity
Hmm.
of the human body. When God created us, we are, in a way, electric beings. We know that there is electrical activity in the heart. That's why we do EKGs. There's electrical activity in the brain. That's why we do EEGs. And then he says in the Bible that for an example, one of the Bible verses is he gives herbs for the service of man. And I've been learning more about herbal medicine and about how many of these medicinal herbs are packed with phytonutrients and antioxidants and are anti-inflammatory and have all of these things to support the healing mechanisms of the body. And I've also looked into this with food, Anna, because I saw this really funny meme the other day on social media, and it was like someone praying like, dear God, please bless the food, and then but the food was like Chick-fil-A. And it's like,
Right.
okay,
Yeah.
God did not make that. So when we just get back to that, the just wisdom of the Bible. I mean, you cut
Yeah.
inside of a carrot, guys, and it looks like an eye. What are carrots rich
Exactly.
in?
Perfect
They are
example. Yeah.
they are rich in beta carotene and vitamin
Yeah.
A. If you're low in
Yeah.
vitamin A, you can literally go blind. We also see this with the brain. We know that the omega fatty acids in walnuts are really, really important for the brain. Well, walnuts also look like the brain. We see this so many times, and
It's
it's
so
just like he's telling us.
what always comes to my mind is, the verse, "We are fearfully and wonderfully made." Just talking about the complexity of our design and the whole world, the world that God designed and the complexities around it. And it just makes sense that there would be, God spoke and the world came into being. So that's vibrations, that's sound. So I think it's very concrete, to be using that and thinking about how that works for the body. It really does.
Yeah.
So I guess one thing that might be different is, there's some people who are interpreting the vibrations as entities that they're calling on that are coming to help them. Now, when I'm using tuning forks, lots of times I'm using guided imagery, and often in a prayerful way, I might help people visualize things. And, I mean, I do believe in angels. People can have angels coming, but I think you just have to think about, you know, are we thinking about what kind of entities are we communicating with? I guess that would be the difference between some of the, taking the energy work in one direction versus um, through faith, through Christian faith. That might be one thing that
Yes.
kind of
And another thing, there's so many practitioners that have gone, into the new age, and then they're kind of like, okay, let's work with your spirit guides, and then we have to think like, okay, what exactly is that, or if
yeah,
anybody is channeling deceased relatives. We know that the Bible's very clear that we are not able to communicate with the dead. That's what Jennifer Niza, who I had on a couple of weeks ago, she was saying that, a lot of these mediums, when they're channeling something, they may think that it is that person's deceased relative, but it actually could be a demonic spirit. And if you truly believe in Jesus and if you believe in the biblical accuracy of the Bible, then you know that Jesus was like literally casting out demons from people and that we have angelic presence in this world. We also have demonic presence in this world. So it really is so interesting and always something to be mindful of. But I would like to ask you, kind of want to go back a little bit about your healing journey because so many people that get a diagnosis that are chronically ill are under the impression that, like, okay, this is the standard of care for you. And again, like medications can be a tool in the toolbox of medicine, they can be helpful when we need them. But we know they're overused in the US. And I think it's so interesting that you were like, "Yeah, that's not for me, I'm not gonna do that," and you did your own thing, and can you, like, describe when we talk about how sick you were in your 30s, what the difference is now in, say, like, your energy levels?
oh, yeah, I mean, so I think it's amazing because I remember when I was first interested in even doing this work, the thought of, first of all, working full time was just like, there's no way I could work full time. There's no way that I could manage an inventory. Like, there's just no way I could carry products or carry supplements and keep up with all that. And, I just felt limited by my energy. So what I did was I was like, okay, well, I'm not ready to be on this level, but where can I start? What can I do? So I started where I felt comfortable and just did what felt comfortable. And it just grew, gracefully and gradually from there. That was kind of how it grew. And then I just continued to study and learn more, and it just shaped into something very different than what I originally thought it was going to be. Because I thought it was going to be more about functional medicine, supplements, things like that, and it's really changed. I mean, there are some supplements. A lot of people just bring their supplements to me because a lot of them are working with functional medicine practitioners already or nurses, and they bring everything to me, and we can use my bioscan test plate to kind of take a look at, okay, which ones are in sync with what they're wanting to do and with their goals and with helping to balance the things that are stressing their body, and which ones might actually be adding more stress. So maybe we pause some of those for a while and work on, what's relevant.
Yeah, I really
Did that
like
answer
that.
your question, or did I not?
Yeah,
Did I get off
no, no,
on
that's
something?
great, but, I really do like that idea because and I have mentioned before that I went through and I guys, I really did find a good functional provider, but the reason why I do what I do now is because I got burned in conventional medicine and then I got burned again in functional medicine, but, in functional medicine, I don't even wanna think about how much money I wasted on supplements, guys, and that's why I'm always like, you must it is so important that you are seeing a practitioner or provider who is practicing with integrity, because some of them really are just pushing supplements. And I am I have used supplements on my own wellness journey to help my body to heal, because again, I was wrecked. I was absolutely wrecked with chronic Lyme. And, practitioner after practitioner was like, oh, here's a leaky gut protocol. Here's its protocol. Here are these really expensive tests. And
Yeah.
I just went through the ringer. And this was, I got, and I had some issues before, but I really went downhill after I had my first baby. But I wanted to get well because I was a young mom with my first child, and I felt like I wasn't able to be present with him because I was so sick. So I was I was so desperate for help, and I felt like people, took advantage of me. But I like what you mentioned earlier about, sometimes when people are really sick, the mitochondria, the powerhouse, that's like the energy powerhouse of the
Yeah.
cells, is unwell, and the body needs energy to heal. And what can just rob us of our energy? Stress, crap food, toxins. And when you mentioned before that you had chemical sensitivity, guys, if you're experiencing chemical sensitivity, you want to think about your toxic burden. That is a sign that your toxic burden is overflowing, and your body, who loves you and wants you to get well, is speaking to you in symptoms. And I wonder as well, when we see, because we both work with individuals that may have chronic, they may come to us with like a whole list of symptoms. And I know we see it all the time, where we start using just, common sense interventions, lifestyle, nutrition, and then using other things like herbs or supplements as tools. But, what are you seeing when you start to experience that someone, like, oh my goodness, their symptoms are starting to go away? What do you think is happening at that, like, physiological level? Do you think it's like
It's
the
wonderful. So what I tell people is that I give the analogy of we are actually made of a bunch of tubes. And the goal is for those tubes to be open and free of debris so that nutrients can get absorbed and that toxins can get cleared out. And what are things that put kinks in the hose? What are things that kink it? Sometimes it is stress. Sometimes it's trauma that needs to be worked through. Um, Other times it is some sort of infection that needs to be addressed. Um, or it can be an allergy, or it can be a combination of things. So I find what I do is I scan people and I look for what what parts of the body are showing priority for this session. Is it the liver? Is it the brain? Is it large intestine? What's showing up as priority? And then I scan and see, okay, what are some of the underlying burdens that people are carrying around that could be causing constriction in our detox pathways and also maybe blocking the flow? And I'll do a scan and I'll find various things. And sometimes it's about emotions. Other times it is about, mold or, whatever it is that they're dealing with. We then work on what do we need to do balance it. Sometimes there are vibrational frequencies that help to harmonize it. Sometimes music, like finding what notes are out of sync. And, because our whole body vibrates like a musical instrument. It vibrates like a musical instrument. So we want to find what are some of the tones, because certain vibrations actually correlate with musical tones, which correlate with color. So we just look at all of the resources available from homeopathy to color to tones using the tuning forks, just all of those things to help relax the body, help our pipes open up, and then help the debris to wash away. And then we're in an ability, it's almost like removing the obstacles, right? Because we're trying to find the obstacles to healing and help the body release those obstacles, and then the body can heal as we were designed.
I love that, and I have not I'm gonna use that tube analogy now. I love that analogy, but I do explain to the clients I work with and also to my students that, we are helped that the body has the innate ability to heal. When clients come to see me, I'm not like, "I'm gonna heal you." I am helping to remove those obstacles, helping you to figure out what is going on, what's triggering this, what is preventing your body from healing. And I love that you mentioned emotions because, and I will say this is a problem. I actually have a Bible verse. It is on my mantle from Colossians, reminding me to forgive because I know that that is something that I struggle with. But
Yeah.
just like in the Bible, it tells us over and over and over to forgive, to love our neighbor. And we actually are seeing this in studies now showing that dwelling on unforgiveness can activate the stress response, which can cause increases in cortisol levels, which those are your like master stress hormones. It can
Yep.
increase your heart rate and blood pressure. When you increase your cortisol levels, that leads to intestinal permeability, AKA leaky gut. Like it is all so connected. So I would love to dive more into this tuning fork situation. Like I am mesmerized by this. I do want to pause for a moment to remind our listeners. This show is also syndicated on America Out Loud Talk Radio on the Nurses Report radio show and podcast. So you can also find me there on any major app. Hello and welcome back. This is Melissa Schreibfetter, and I am joined today by my friend and fellow coach, Anna Aycock, who is a certified nutrition and certified light energy coach. And we are talking anything and everything about health from where she had her own health journey, which really influenced all of this great work that she is doing with her own practice. And she uses multiple different modalities, everything from bioscan to light therapy to, again, the wonderful nutrition and lifestyle coaching that we all need. And something else that I am so interested in, and it is the tuning fork. And it sounds so when you're talking about like, oh yeah, I'm using tuning forks, a lot of people are like, well, what is that? And I have nurses that I have trained that also they're kind of on the same page as us, where, most of us have experienced health issues. Then we experienced healing using holistic things, and then you can't forget about it. You can't shut up about it. All you want to do is like share the word, share this message with other people that there are things we can use to heal our bodies. So, what exactly is a tuning fork?
Well, I should have pulled it out. I thought about pulling it out to show you, but the tuning forks, these are the tuning forks that have been around for a long time that were used to tune instruments. So, you would hit the tone and then it makes a sound and then the tuning fork next to it vibrates with it. But it could be used to tune the piano in the old days. Could be used to tune the guitar. So it started out as a musical tool, an instrument. But people have also been using that as a way to tune the body. And so one basic way to think about it is different notes actually vibrate and balance and harmonize specific organs. So there would be a specific tone or note that could be used if your liver is stressed and it sort of relaxes it. And again, you can go back to what do people do when they listen to music? How when they make movies, how are the movie producers using music to control the mood of the viewer? Right? So that's a good way to understand that sound can have a profound effect on us physically and emotionally. Um, and you can use tuning forks to listen as well. So you can actually strike the fork and we have an energy field that projects outside of us. The other philosophy is, you know, our bodies are inside our soul. So our energy is actually outside of our body, and we can listen to that. We can strike the tuning fork and listen, and the tone can change based on how that sound bounces off the body. And not only, the body in general, but bounces off the liver or bounces off the lung. You can listen specifically, and different vibrations sound differently. Um, Viruses sound different than parasites. Like you can hear someone who's highly trained in using tuning forks can hear all of those things, and then can hear the change when you support the body with a certain supplement or a certain color or a note, how it harmonizes things. Um, so it's really fascinating. You look like you have a question.
Oh, no, I'm just so excited over this, guys. So
Okay.
when Anna is talking about the basically the energy fields, what I think is so cool coming from the medical side of that is that we know and I talked about the heart earlier. We know that these energy fields, they are measurable, guys. Like the heart's electromagnetic field is like one of the most powerful. And it can extend up to, I don't know, up to like 3 to 4 feet out of the body in all directions. And then we also know that there are certain things that can really minimize or alter our energy field. So again, there are things that like are not visible to the human eye that are absolutely tied to our health. And I think it was so interesting. You said that the soul is outside of the physical body, is that right, Anna? Do you
Right,
think that
right.
the electromagnetic field of the body, like that is the soul, or the soul is like entwined in that? I'm curious.
That's probably the soul, or our
Mhm.
spirit or our soul. And our bodies, biblically, our bodies are temporary. So our spirit, our soul is what's going to go on after the body passes away. And that's bigger than us. It's bigger than us physically. And, you can feel, some people, have you ever been in a situation where everything's fine, you're with a group of people, everything's fine until that person enters the room. And just that person entering the room, their energy, you can feel all of a sudden everything gets thick, and you may not even have an issue with that person, but there's something about what they project that you can feel, you can pick up.
Uh-huh, yeah, and it's so interesting, and guys, it reminds me, I remember when I was single, and I had a friend that set me up with a guy, and, he walked into the room, and I immediately was just like, ugh, like, it was so I picked up on something, and this was before I really knew about all of these things, but I think that when you are aware of it, you can be more in tune with it. And now some things that would alter someone's energy field is probably what? Like illness, physiological stress, like what's your
Past trauma,
okay.
past trauma. It could also be music, like heavy metal music, that sort of thing that really, there's a difference between listening to music that's relaxing and uplifting versus something that's really dissonant chords, dissonant notes. Now, everybody needs to balance, so for the person who is way too far in the flowery, everything's beautiful, happy, happy, happy. Maybe they need some of the dissonant chords to come and bring them, more balanced. So, I'm not saying that necessarily, certain vibrations are bad or good. It's more kind of about the individual person and needing balance. And let's go to the example of that person who you can feel their energy in the room and they're just dark, right? There's just a darkness.
Yes.
So we might be able to help them if they came in for a tuning, doing tuning fork. We could actually present the vibrations and the notes and help them clear whatever it is that is created a negative energy in them. Were they wronged terribly in childhood? Are they grieving the loss of a loved one? What is it that's making them project Eeyore, from Winnie the Pooh? What is it that's making that? And so, we can support them and help clear and tune their energy by I also studied with Eileen McCusick. So the tuning that I do, I've combined different schools of tuning fork training and kind of created my own. But Eileen McCusick, uh, she's very well known for biofield tuning, and so she talks about that we have a biofield, and you might have had a trauma that left dissonant energy off your left hip, so you then can take that tuning fork and listen for it and gently strike the tuning fork so the person hears the tone and the energy bounces back off them, and it starts to resolve that dissonant chord. It starts to calm that down and bring it into harmony. We want the whole body to be in harmony. So that's done. That's another way of doing it. The other thing that I will do is um, again, going back to the analogy of pipes and tubes and cords and everything, we want the energy in our body to flow freely. So I might even like I have a client I was doing a session with, and if something pops in my head, we'll discuss it. And I'll say, I want you to imagine that there are a bunch of boulders that are blocking the river flow. It's just like so all that's coming out of your river is this little trickle. So I said, I want you to think as you're listening to this tone, let's bring our attention to that boulder and let's see, can we give it enough energy and can you embrace the music and the tone and use that energy to let the water flow push through those boulders and send them on downstream so that what's blocking that flow is now open and it's flowing freely. And sometimes we talk about what do those boulders represent? Were there sadness? Was there abuse? Was there a great loss? What was it? And in prayer, during the session, we talk about, you know, can you give that to Jesus? Can you these are burdens. Can you take that? What do you want to do with that? And I'll ask them, what does it look like? Can you describe it? What does it feel like? What does it smell like? Just really get into feeling that. And then can you hand that to Jesus and let Jesus help you remove that boulder, remove that obstacle? So that's an example of kind of the guided imagery that I use.
Oh, I love that, and that's actually on the assessment form that I use. I ask them, "Do you have a religious preference? If so, do you want to incorporate that?" Because it is no coincidence, guys, it is no coincidence that once we incorporate that and then we start asking Jesus for help and we start praying for good health, that we see better outcomes. And again, I've talked about this a lot. Talk about it all the time. I need to have these people on here to interview them. But go to globalmedicalresearchinstitute.com. That's where you can read about these peer-reviewed published case studies of but basically medical miracles, And I remember that there's so much of like talking about meditation and mindfulness and the universe, but then, there's I used to use these meditation apps, and I remember one of the ones for forgiveness, it was all like, "Oh, just imagine all of those things that you're working to forgive people from, put all those emotions and balloons and just let them float up to the sky," and I was like, "No, like, as a Christian, I should be like, 'Here, Jesus,' because we can ask him, we can pray to him, cry out to him, ask him to help to release you of these things." And I will say, I really was struggling with unforgiveness, guys. Because I am that person that's like overly nice. People will wrong me, and I'll be like, "Oh, it's okay," and I won't say anything. And then when they leave, I am beating myself up over it because I didn't stand up for myself, and then I'm dwelling on it. And those thoughts, guys, those like I remember feeling it. It almost felt like my stomach was just being like twisted. Like I could physically feel it. And once you release it, oh my goodness, like it takes so much energy from us to be dwelling on these negative emotions. Like it's
Right.
awful. And I like that you can use this type of modality to kind of pinpoint, because the body is so miraculous and it's so resilient, but helping people to kind of pinpoint what may be some problem areas that we can focus on. So, if I'm
Right.
hearing you correctly, so you're saying that the tuning forks, how they're working is, the body has an energetic field. And
Right.
so, and you're saying that there can be blockages within that field, which can be physical things like infections. It can also be things like emotions and things like that, where things have, really gone off balance. And then with the tuning forks, you're helping to basically put that to help get the energy fields back in order and
Right.
clear those blockages. That way, the body can basically have the energy to properly heal. Is that right?
Exactly. And actually, the way Eileen McCusick talks about it is you've had some sort of trauma or some sort of event, and some of this can even be genetic. Like it could be an ancestral thing that, when we talk about, our DNA can be changed by trauma that happened to our ancestors. So some of this is going way, way back. But whenever something like that happens, your energy gets spilled outside of your core and it's out there. And so then you think about mitochondria. Your inner battery is drained. You don't have as much energy to use. So what she teaches is that you take the fork and the practitioner feels that energy out in the field and hooks onto it like a magnet and gently brings it closer to the body, closer and closer while you're doing guided imagery, and then you bring it all the way into the center of the body, whatever organ system you're working on, and you pour it in there like honey pouring off a spoon. So you're actually restoring the lost energy back to the person and increasing the resiliency and increasing the mitochondrial energy.
That is so fascinating. And I like how you're talking. It kind of reminds me. So when I had Lyme disease, guys, and I remember I went to go see you when I had Lyme disease because I could not even tolerate the herbals. Like, I would take a couple of herbs and I would totally crash from it. My body couldn't handle it. And then my Lyme literate physician was like, "Yeah, if you can't handle the herbs, you definitely can't handle the antibiotics." But one of the things that you pulled up for me, and I haven't done the tuning fork sessions with you. I am going to get on your schedule for that, though. I'd love to do that
Yeah.
sometime. But anyway, one of the things that you pulled up for me was liver. And these chronic stealth infections can really stagnate the liver. And then people who may have sluggish liver pathways, they
Yep.
cannot properly detoxify that. And as the body is talking to you in symptoms, say that you're
Yeah.
taking herbs or antibiotics to kill off some god awful infection, but your detox mechanisms are not prepared for it, the body is going to make you feel awful and feel really tired. And one of actually, the modality that I use to get healed from Lyme, like, thank the Lord, and I don't know how to explain it, but it was called Craniobiotic Technique. It was a clinic called Lime Stop. I went up to
Mhm.
Wisconsin. My, holistic nurse practitioner referred me there because she was like, yeah, like they're like literally just like healing people, from Lyme. But anyway, one of the methods that they used, they had magnets. And, it sounds so it's silly, but then it's really not silly if we know that we have these electromagnetic fields of the
Exactly.
body, but they use the magnets and then something to do with the energy fields to direct the immune system to where the infections were. And
Right.
then I, did have some die off. I did not feel good for a
Yeah.
few months, but
Yeah.
I actually, I remember after I had this last baby, I was like, I feel like a normal person. I felt so good that I went and had another baby. Well, I mean,
Yep.
he's still in the oven, but I went and I felt so good. I had back-to-back babies. But
Yeah.
but it's so interesting because and I also really appreciate these techniques because as we all know, we have a lot of sick kids in this country and my first job in the nursing profession was as a pediatric nurse. And I was like, I can't do this job because I can't stick kids and put tubes in them. But it is so traumatic to take a little kid and go and get a blood draw from them and do invasive procedures. And I like how there are modalities that you can help to investigate what could potentially be going
Right,
on.
without having to do that, yeah, and then, I mean, the other side of this is, if we're thinking about unresolved trauma, you were talking about liver, right? So, the liver was harboring pathogens, but we also have to ask what emotions or feelings could have been happening that attracted that block in the liver, and the liver usually resonates with anger. So, when people have liver things, I'll say, is anything, are you really angry about something? And 9 out of 10 times they'll go, yes, I actually am. You know, so that anger kind of creates a magnet. The energy of that creates a magnet for those flukes or whatever it is to have a happy environment there and stay there. So, in addition to whatever you're doing to detox, working on the underlying emotional um, component, which with the liver is anger, also helps to open up the pipes and keep everything flowing. So there's so many levels of support for the body. And the main goal is opening everything up so that the flow in and out is as strong as it was designed to be.
And I'm also interested when you are working with your clients and you're using a tuning fork, if there is significant imbalance in an area of their energy field,
Yeah.
can you physically feel it?
Yes, yes, you can. So it will feel like sometimes when I'm combing the field, and again, that's an Eileen McCusick term, but when I'm combing the field, I will feel sometimes I'll feel like a current, like imagine in a hot tub with the jets blowing against your hand. Sometimes I'll feel that. It's like a current that's pushing the fork backwards. And that's where there's something really strong that we need to work through. And so, we talk about it, we continue to tune. Sometimes we have to use a different note, switch tones to a different fork because you have a set of forks. You don't have just one fork. So that's a block. Like you can feel it. Other times it will feel like ripples. It'll feel like bubbles. And I usually take my hand and I'll just put here. I usually I'm doing this sort of shape as I'm combing. And so sometimes when I'm combing, I'll feel it. It feels like this. And other times it feels like this. And so, that's important. And it encourages me to know where do I need to focus? What do we need to be working on? What do we need to be talking with the person to encourage them to focus on that area so that they can release and release what's interfering with it and then receive that energy that they need?
And so, I also wanted to ask you, do you have any success stories that you would like to share? Have you ever worked with a client where after you did a session with them that they noticed measurable change?
Yeah, so I have a client who loves the tuning fork sessions, and she experienced it. She was having a lot of neck pain and thyroid issues, which makes sense. So there's constriction in the neck, pain around the neck, and then, thyroid, the energy around the thyroid is not as it's designed to be. So then you have thyroid issues. So I did a session with her, and, I look for what part of the body's priority. Sometimes the person says, my neck hurts, and I actually need to be listening to the foot, or I need to be listening to the hip. But with this person, she said, my neck really hurts and my shoulders hurt. And the energy showed me that it was around the neck that we really needed to work on. So we worked, I combed through the field, we talked about things, and there was a lot of things that went back to her childhood. And as a child, as a young child, she felt very alone and she was not really able to express herself. Like she could not say what she wanted to say. And even today, things that she believes and wants to share with people, a lot of people don't want to hear and don't want to receive it. So she feels closed off. So, we worked on that. We worked on the energy around her neck, around her throat. Um, we talked about, okay, so there are things that you want to share with people and they don't want to hear it. So let's find another way for you to express it. And I do believe that expressing something with your voice is a totally different thing than writing it down. Journaling is amazing. But when we're talking about the energy and the music and the tones, she needs to actually speak it. So I just encouraged her and invited her when she's by herself, verbally say what she wants to say to these different people, even if they're not there, or especially if they're not there. Express it, unlock it. She needs to say it, whether they can hear it or not, she needs to say it. So we did that. We worked on, just kind of clearing the tightness in her neck, the energy around it, bringing the energy from way out in her childhood, dragging that energy all the way, about 6 feet, dragging it 6 feet all the way to her neck and then pouring it back into the area over her neck like honey dripping in. And it changed things dramatically for her. And she really felt like her throat was not sore anymore. Some of her, coughing, like a lot of the things that were creating a lot of tension and constriction cleared for her. So she felt really, very much supported in that session. Yeah, very much.
Oh, that's so amazing. And again, there are so many ways that we can remove these obstacles, guys. And again, like I that's one thing I love about holistic, medicine and functional medicine and all these things is we're looking at everything. We're looking at like diet, nutrition, stress, what's your environment, what's going on with your psychological stress. Like, are you holding on to stored emotions and things like that that could be negatively impacting you? Whereas with the conventional medicine model, everything is fragmented. I mean, you go to your PCP and you're like, my stomach hurts. And they're like, go to the gastroenterologist. You have a migraine. Go to the neurologist. You're having hormone issues. Go to, the OB or the endocrinologist. And then no one is communicating and no one is even like, it's not even on the radar about why does this person have this dysfunction. It's kind of like, here's your symptom, here's your diagnosis, here is your drug. And I think it is so great that people know that there are other options out there, And again, some
Yeah.
people may not want to go the holistic route. They may want to go the drug route, and that option is available for you. But I think it's so important when we talk about chronic illness, some type of chronic symptom, that individuals know that there are other options out there. That way they can make the best healthcare choices for themselves. And I think a lot, I think I'm going to get a lot of feedback from the show because, again, like there's a lot of people, I have a lot of listeners that I think are going to be super interested in this for their own health. And then I have a ton of nurses and other, healthcare professionals and coaches that listen in that are also probably interested in adding this on as a modality. So, can you tell us for our listeners, where is the best place that people can find you and learn about your work?
So my website is balance number two you.com. So, capital B balance number two, capital YOU.com. So that's probably the best way to, kind of maybe see a little more about what I'm doing. And then I usually schedule appointments through Calendly. And I do in-person appointments as well as remote appointments using tones of the voice. I listen to the tones of the voice, and I can work with people that way and get a lot of information that way.
That's wonderful because again, there are some people who in their area they may not have a holistic professional that they could work with. So I love that you can also see people virtually, and that is all the time that we have today. Thank you so much for tuning in. And again, if you want to learn more about the Functional Nurse Academy, please feel free to register for our next live webinar, and you will see that link in the show notes. You can also check out Functional Nurse Academy on our social media platforms or on our website at functionalnurseacademy.com. Until next time, be safe, be well, and God bless.